Good afternoon. A warm welcome to all our esteemed guests for IndiGlobal Healthcare Summit. IndiGlobal Healthcare Summit is a 2 day summit. Today is the second day of the summit. We are going to today discuss mental and social well being in the COVID-19 era. It has been noted that the social and mental well being during the pandemic came to the fore as there was a lot of stress observed. Stress in terms of people falling ill, stress in terms of people losing their jobs. There were many who lost their loved ones to the disease. There was also isolation when people were ill. Many of them were left alone in the hospitals while families were at home. This was a very distressing point for many of them. The worst that came in was panic. A lot of people did not understand what is a pandemic, what is the disease, and how must they deal with it. This brought the underlying trauma to the fore. This also brought out the different mental health issues which many of them have been suffering from. What was a panic attack? What is an anxiety attack? Came to an understanding during that time. So today we are going to discuss about the social and mental health pre and post COVID and how have different people coped up with it. Today, we have with us esteemed speakers. We have from Chennai a senior psychiatrist, Dr. Vasantha Jayaraam. Welcome, ma'am. Welcome, ma'am. Good
Thank
afternoon.
you. Thank you. Good afternoon.
We also have with us Dr. Jini K. Gopinath, Chief Psychology Officer, YourDOST. Welcome, Dr. Jini.
Thank you.
We have with us Dr. Pragya Rashml, Consultant Psychologist at Yashoda Hospitals. Welcome, Doctor. We also have with us Dr. Vishal Chhabra, President, Delhi Psychiatric Society and psychiatrist Fortis Healthcare. Welcome, Dr. Vishal.
Thank you.
Thank you. So, what we have realized is that as the mental health issues are now the prime focus also of the government, where there is a national health mission which is also focusing on the mental health problems in the country. We will today discuss about the mental health and how COVID-19 has brought this issue to the forefront. My first question would be to Dr. Vishal. So during COVID-19, we found that a lot of people who had existing mental health conditions were the first ones to report to hospitals with their panic and anxiety attacks and other mental problems. But there was also a range and a number of people who had an underlying condition who came which came to the forefront. So
Right.
what was observed in the first, second, and the third wave, if you could elaborate?
So that's a very large, actually, question.
Yeah.
Thank you. First of all, thank you, IndiGlobal, and for doing this important webinar for awareness of the people all over India and abroad, I hope. Uh, this is an important thing because I think before this COVID pandemic happened, nobody was taking that much care of mental health. Mental health was not in the forefront. But when people got cooped up in their homes. They realized the normal coping mechanisms of dealing with anxiety, depression, the way, how used to people cope? People used to cope by going out, meeting friends. They used to go out for a movie, malls, holidays, all that stopped. And the way people realize that there's so much going on in their heads and there's no way to cope. So I think that's where anxiety and the fear of unknown, we had no idea how long the COVID will last, how dangerous this is. Uh, Especially the second wave was very, very, I must say. My audio is clear?
Yeah,
Okay.
we can hear
Yes.
you.
Yeah,
Yes.
okay. Shine a light, Lara. And so, so what happened was that I think when this kind of crisis happened, I think all of us realized that our mental health is much more important than we take it to. We took it for granted, and so the different levels this thing has played out. People who were undergoing mental health issues, people who required regular medication, regular counseling services, the children with special needs who were going to special schools. There, we saw the first wave cause a lot of problem because everything was shut down. People could not buy medicines. A lot of people were dependent on government services. There were a lot of people dependent on special services. All that when collapsed, it caused a lot of crisis in people, and we saw an increased level of psychotic breakdowns. We saw patients becoming suicidal. We saw an upsurge of depression and anxiety. All that we saw in the first wave. But when things started opening up and things got a little better, interestingly and nicely, Indian government uh, revolutionized using the technology. They agreed to have teleconsultations. So telepsychiatry started. Government made guidelines for it. Indian Psychiatric Society also ratified those guidelines. And so in March itself, March 2020, we started having online consultation. That played a lot of important role in helping a lot of patients. So that was a very good step at the same time. So in crisis, there was this opportunity which was grabbed, and we got this benefit. Second, in the second wave, which is very, very devastating, people had, I think, given up. People thought that everything is all right. People are out, and the COVID is gone. But the way the severity with it hit everyone, the whole infrastructure collapsed, and we saw lots of deaths. I think that created a lot of crisis. And still, till today, it's almost one year is going to happen in April. I still see patients who lost their loved ones, and they have the survivor guilt. They have crying. They still cry. They have a lot of depression, anxiety, fear. So much has happened because of the second wave. Third wave, thankfully, was not that severe, and thankfully, most of the India was vaccinated. So we did not get that severely hit by the third wave. So thankfully, we don't see that much of effect of the third wave. But second wave and first wave, second was very, very devastating. Only last week I got another case where that woman got lost her mother, and she's still not able to cope with it. So I've seen a lot of cases. I think I'll have 100, 200 cases of uh, people who have lost their family member, they lost their husband, they lost their father, mother, or both, or they've lost a younger child, and they're all very upset with the thing. So
Yes,
that
yes.
that thing is still going on, playing there.
So there has been a lot of trauma around, while people are not really open. A lot of thing is secluded in homes and within a person. That is what is being noted. There's also an aspect of violence which a lot of children saw. So my question would be to Dr. Pragya. Ma'am, what is it that has been seen in terms of children? Because children were witnessing violence at home, and that was one factor which was upsetting a lot of them. There were schools also which were not running, so they had no place to go and talk about it. If you could elaborate on that.
Right. So, as Dr. Chhabra told us so nicely, what happened was, if we divide it into the three waves, the first wave, there was a certain unpredictability. Now, in human beings, right from ancient times, whenever there is unpredictability, we have unpredictable behavior associated with it. So automatically, when the parents were behaving in that unpredictable manner, because there's impending doom, we don't know if I'm going to get COVID, if my elderly father is going to get, if my child is going to get. So when we were in that space, automatically our own behavior as adults was not very stabilized. We were all distressed. I will not use the word disordered. I will use the word we were all distressed, and we had behavioral symptoms that we were unknowingly portraying to our children, and our children, as children go, as development goes, they were modeling our behavior. So children saw us anxious, they modeled our anxiety. Children saw us afraid, they modeled our fear. And as you know, there are two things that we must understand here, that we talk about the new normal. Now, I have never understood this word normal, so I can't elaborate more on it. I don't really know. Norms keep changing as society changes, so what exactly is normal, I'm really not so sure. But our old normal, if there be one, was not very working amazingly for all of us, because we all had our set of escape mechanisms. Now, what do I mean by these escape mechanisms? Like Dr. Chhabra told us so nicely, we would go to a movie, we would go to a mall, we would just avoid people, we would we didn't have to stay together as a family. We could go places, we could escape. So one of our primary defense was denial. Of course, has been a very strategic defense that most of the human beings prefer to use. And then there is that escape mechanism. Now, this escape mechanism was gone. This escape mechanism could have been something as small as going out for pani puri. IT workers going out for their little what they call sutta break in Hyderabad, or you go out for a you just chit chat around the office. Now, all of these little pauses of life are gone. So, naturally, as an adult, you are distressed tremendously, and you're carrying that distress inside your home. In your home, which otherwise is not your office. Now, since there was work from home, there are children who are blindly aping it. Now, children of different ages, you talk about domestic violence. I'll tell you this, the children who are of the developmental age, right? Let's say less than 6 years, uh, there has been this language development that went down. Now, is it because all the time they were being told, just keep quiet and stay in one place? Keep quiet and stay in one place. They are not in a board meeting, you are, and it is their home. They behave in a certain way. There are sounds, there are some the sounds of everyday living inside a house, a pressure cooker. People don't want that. There are so this merging, this hybrid way of living did not really work for us, and as a result, aggression aggravated. And how? I think in my 20 years of practice, I've never seen as much as domestic violence as I have seen in this last, nearly close to 2.5 years now. People were, I saw elderly people get angry. I saw geriatric people come up and say, I don't want to live with this man anymore. So marital relations breaking up, cracking up, the cracks that were there, making themselves visible to us now under pressure. Children were blindly just subject. They were like shadows. They were shadows that were absorbing all our negativity. So the effect that this has had, the future will tell. When these children are maybe, when we are out of the pandemic purely, and then we will know what exactly. But as of now, we see a lot of, they don't trust anyone. They don't trust going back to school, because they, anybody can just go away. Death, something that little children don't really fully grapple. They are not developed enough. They saw that, and therefore my teacher can die. One child came to me and said, I don't want to go for sports class because he runs around, what if he dies? About the yoga instructor. So this, it was a vicious cycle of negativity that the children got trapped in, and very unknowingly, because we were so busy trying to cope with it ourselves. Where was the time to do extra for children and adolescents? So I think I'll leave it at that. And
Yes, yes, that's a very important point. Thank you, Dr. Pragya. And that also brings me to my next question to Dr. Vasantha. Ma'am, there were a lot of people who lost jobs. So many homes and many families have seen a lot of financial stress. This financial stress also has reflected inside the home. So there has been, we have also unfortunately seen suicides during that time, where people could not cope up. And it was not only jobs, it was small businesses. There were many people who just didn't know what to do, and who could not go online, or who had rather no skills to immediately shift. So, what is the impact and what has been noted? Ma'am, you're mute, ma'am. Ma'am, you're mute. Yeah. Uh-huh. Yes. Ma'am, you're still mute. Yeah, you'll have to unmute. Okay.
Can you hear me now?
Yes, ma'am.
Okay. Good afternoon, everybody. At the outset, I would like to thank IndiGlobal Healthcare Summit for giving me this opportunity to speak. And I'm extremely delighted to see my mental health care professionals, Dr. Pragya, Dr. Jini, and Dr. Vishal Chhabra. Well, coming to the fact that you raised about economic implications of losing a job, I think this affected both men and women on the whole. And the lower middle class, the middle class, and the lower class were more affected. Okay. Yes. Apart from the few people who could work online, others were extremely affected. Any economic factor, no, will affect the family life because you're not sure about the money, you're not sure about your day-to-day happenings, how you would survive that particular month. So you found men becoming very irritable. I'm not saying they have every right to become irritable. This was also one of the causes, one of the reasons for domestic violence. Okay, they would show that anger and frustration on the wife. Okay, and women lost more jobs than men actually because the women had to stay back and look after their children. So some of them had to take a break in their career because they didn't have somebody to look after the children at home. So that was another factor that also caused a lot of frustration. And mental health and our own healthcare professionals, where you find a great number of women working, they were also to a large extent affected because neither could they take leave from their work. They were expected to work extended hours. And at the same time, they had the fear of bringing COVID infection home. And some of them, when they didn't have somebody else to take care of the children, they were extremely affected. In fact, I had a great number of doctors and nurses seeking psychiatric help during the pandemic. Uh, and the other thing was they were also exposed to a lot of negativity. They were not sure of what the outcome of the pandemic would be, what their treatment outcomes would be. And generally, when patients are put on the ventilator, they don't last long. But in COVID, the patients were there on the ventilator for a long time. So that had a major impact because all the time they were thinking that the patient would rally around, but ultimately the patient would succumb to the disease. That much for the healthcare professionals. As far as other professions were concerned, yes, people lost their jobs. People were not sure what they would do next. And if they are not well qualified, they didn't have any access to some other kind of job. Apart from people who were working in the public sector or in the government sector, they sort of managed. But even then, the exposure to COVID was very high. You would have noticed at some point of time we had banking officials, people working in metro department, people working in municipalities coming with COVID. So even when they had a job to keep, they found it difficult because the exposure to COVID was high. And if you look at the people who are working, it is a working population, right? Maybe from 20 to 60 and all that. So the second wave, we found a lot of youngsters developing COVID. So that was again a fear, whether you go to work or you don't work, and you definitely need to work. And I think the vaccination hadn't covered that population by then. So there were a lot of issues because of the job. Even if they had a job, there was a lot of stress. And if they didn't have a job, yes, it led to further problems. So the uncertainty at home, and for us, we don't have much of government support, unlike other Western countries. So naturally, definitely it took a toll. And yeah, the cost of COVID treatment. Once somebody gets COVID, not everybody could get admitted into a government hospital. So many people had to take a lot of loans and debts. Many people fell into debt. And sometimes the person is put on the ventilator or things like that, the amount you spend just goes out of control. So there again, it was again a stress, the guilt, whether I should do this much or whether should I start somewhere. So in every aspect, the economic aspects, loss of a job, or even if you held a job, again, it did cause a lot of trauma to the people.
Yes, very true, ma'am. Yes, and there were a lot of people who, over a period of time, who had never seen any difficulty, actually understood what it was. A loss of a job, a loss of a person, a loss of a loved and dear one, and especially students when they heard from their college colleagues and all, that their professors are no more. It was a lot of trauma. So there have been these aspects. Now there is also one section of the society which during the first wave was in hordes in the hospital. So my question is to Dr. Jini, those with substance abuse and those who were alcohol addicts. After the first lockdown that we saw, within 10-15 days, we had government hospitals which were full of patients who were addicts. And these people were the ones, who came in droves. So I wanted to understand what exactly and how did they cope up and what has been their state, because in the second and the third wave, we didn't see a phenomenon like that, but we did see a lot of addicts in the after the first lockdown. And how was it? What exactly has been their state?
Thank you. So here, what happened was this came up all on a sudden, right? All on a sudden, it came up, and the people are not prepared for this kind of lockdown. So a lot of terms came up, like quarantine came up, social distancing, which led to social disengagement. Then after that, people were on regular treatment from part of this de-addiction units or from psychiatry units. They had to suspend their treatment because of not able to go out or interact with people, because it became secondary. So the primary focus was on the COVID patients, and all the other specialities took a backseat, especially when it comes to mental health. And we never had a preventive strategy for mental health. We always had an intervention strategy for mental health. That also led to this problem. And another one, most of the people got into this addiction also here. They were vulnerable. They started getting into addiction primarily because as a coping strategy, because they found that the usual conventional strategies were not working. Say, for example, Dr. Vishal very clearly mentioned that. So spend our how did we cope with our previous anxieties and worries during pre-pandemic 2018 and 2017, going for a long drive or going out, meet people, talk to people, or going to the shopping mall, movies, short vacations, these are all completely shut, right? So this could be one reason why they had to move to the unhealthy coping strategies, not only for substance abuse. If you see the gambling in the so there was some of the studies from US, they say that there is an increase of around 255 percentage in the first time registrants of online gambling. And also in the this gambling, initially people started using for fun, but now they started moving into money making and things like that, because they have lost their jobs and all the other things. So here what happened was kind of an unhealthy strategies they're getting into. And one another medical complication came up, because some of the addicts who are into regular drinking, they had to suspend their drinking. What happened was, in between, because there was shortage of supply of alcohol, right? So then it got into withdrawal symptoms, which led to a lot of these medical and other complications, which also led to this emergency. But one more important process here is why there is a issue in terms of seeking help, is primarily because of the stigma and discrimination which was always attached with mental health right from the very beginning. Because we work with predominantly in the online segment, we could see that there was an increase in the number of people seeking support in the online platform in the last 3-4 years. Not And during this pandemic, it increased a lot, around 100 to 200 percentage increase in the online usage. So I think that also needs to be discussed from a socio-cultural and also socio-political perspective, so that we will be
Yes.
able to complete this entire picture.
Yes, yes, yes. So that brings me to my next question. Now, when you look at it in this way, do you think that the stigma which is attached to mental health in the last 2 years of COVID-19, are we finding that a lot of people are now openly coming forward? So my question would be to Dr. Vishal, what do you think? Is the stigma still there or has it reduced a bit? Or are now is the younger age group more comfortable in coming out in the open and saying, yes, I do have a mental health problem and I need it to be addressed?
Thank you for this important. But can I, with what my friend Jini was talking, can
Yeah.
I just add to that? It's
Yes,
very
sure.
true about the substance abuse. A lot of people took up to substance abuse to deal with the anxiety and restlessness which was happening as part of the COVID. But few people, okay, majority were increasing, but there's few people who did use this opportunity to quit also. So there were people who just needed a little bit more, you know, because when we admit somebody in a rehab center, what do? We avoid alcohol. I mean, we remove that person from the surroundings where alcohol and tobacco and other things are available, not available, and person does use that. So a lot of people who have, not a lot, but some people who had good willpower were wanting to do it, but somehow they couldn't do it for one reason or other, peer pressure, availability of substance. Lockdown did help some people to quit. So I just wanted to highlight that also. But what Ginny said is right. A lot of people did increase as a coping. This good. There's always a silver lining in a black cloud. So this is what happened. Now taking that analogy itself of silver lining in a black cloud, same thing happened with the stigma itself. Now stigma, uh, the stigma is a lot more for mental health. Because mental health means mental illness means pagalpan. Pagalpan means person who's not in touch with reality, who doesn't know what the person is doing. Now, when people realized, Are, I am a corporate person, Are, I am an engineer, Are, I am this and that, and still I'm suffering from the anxiety and worry. Where do you go to? What do? You can't. Coping mechanisms are not available. So people did start calling up doctors. So I did see a lot of patients, youngsters especially, coming, approaching. "Okay, my father is having anxiety, mother's having anxiety, I'm having anxiety, my spouse is having anxiety. Can you help us?" And thanks to telepsychiatry, I did. So I have treated even people as far as Chennai also. I don't know how did they find me out, but instead of going to Jini, they called me. So in Hyderabad. So I don't know, because of the internet and people Google search and everything. Everybody's available everywhere. You know. So so and since telepsychiatry is legal now, you can legally see a person. So that was very important for recording in progress. This one. So next, please. Okay. So what has happened was, because of this thing, the stigma has come down. So when people start taking treatment, they realize, okay, I can get better. Oh, with some counseling, with some medicines. So people are, and then they brought their friends, and they brought their more friends. And that's why this awareness is increasing and growing. So I think this is nice. Another thing, what happened, thanks to the uh, this social media, like what we're doing right now, we're creating awareness for mental health. So a lot of other my friends and colleagues from all did a lot of programs online because we were free at home, so we didn't have to go anywhere. So we did a lot of programs, and I think a lot of that also created a lot of buzz and awareness about mental
Yes, very true, sir. Very, very true. Yes, but I would also like to know from Dr. Jeannie if the online consultation has increased by 100%, as has been said. What are typically the calls that you all get, and what is it that people are reporting to you all with? What are the kind of mental health problems you all see the most, or in large numbers, where people call in?
So mostly in this last 2 years, mainly the calls are predominantly from anxiety spectrum, the emotional disorders, generally anxiety and depression. So what happens is that right now the increase in the calls, if you see the age group, they're all mostly from student population because they had access. They have all the almost all of them have access to this internet, mobile phones, and there is open discussion about mental health services, and they have these access to these kind of service, and stigma is slightly less in that particular population, primarily because of these awareness programs and educational frames which is available in the university setting. And also we have seen a very interesting statistics where we see that mostly from the remote areas where they have very less access to a mental health professional because they had to travel. Previously what happened, they had to travel to a nearby city to meet a psychiatrist or a psychologist. But now what happens, if since it's available and the internet is available in almost all villages now, so they have these easy way to connect with a mental health professional. And also one more segment which we which we always miss out, is the sports professionals. Where if you see in 2019 and 2020, some of them were in that peak of their career, elite performance. They were in their elite performance, and suddenly almost all these training academies, tournaments, it has shut down. So they have gone into that deep training syndrome where they had a lot low motivation levels. They had a lot of these emotional anxiety issues, and some of them were not able to come back even in 2022 because their form they have lost. Only these certain segments, say for example, we have seen that the last 2 years only IPL happened, but all the other leagues, they are suspended or cancelled or postponed. Right. Even Olympics also they had to postpone it. So what happened, that segment is also another area which that impacted a lot. But to answer your question, it's mainly the emotional disorders, and mostly from the adolescent young adult group in the universities. They were more aware, and the stigma and discrimination is kind of less in that particular group, primarily because of the awareness programs done by the social media and other groups.
So can we say that people, in the middle age and senior citizens are just silently coping, or are, there would be segments of them also who would require help, but they are not
Now,
reaching out or they are
I
not
wouldn't say
aware?
that it's less. I would say that they are still
Okay.
there, but mostly from the younger group. But if you see the statistics, it's still statistically significant from this middle age and the old age population. Say for example, the corporate group who are in the middle age population, right? The corporate mental health services are slightly on the rise right now, where a lot of people interested in the EAP services, and most of the companies are taking it, buying it, and it's very popular because of the awareness built in that segment. So uh, we can see that statistically, the slightly on the higher side is the younger crowd, but the other group is also taking the services online.
Okay, okay. Thanks. Thank you, Dr. Jini. Dr. Pragya, could you tell us what is it that you see at the hospital level now after the three waves, and what kind of patients are coming in, and especially from the middle age and senior citizens? I all seeing a number of people in that age group, probably maybe as they may not be comfortable online, so now they know that yes, the doctor is sitting in the hospital, we can approach them now. Pragya, you're mute. You're mute. You're mute. You're mute. Yeah.
Thank you, Kariza, for that one. And I think we need to start by understanding that a lot of people, mental health, mental disorder, were synonymous, right? So me trying to be healthy as a physically healthy, and me having a cardiac issue are not the same things. Exactly that way, I think people, one of the most wonderful gifts that the pandemic gave the mental health industry, or all the workers or this entire field, was that it made people aware of signs and symptoms that they had within themselves, though they did not have a name for it. They were not academically or cognitively aware of that these had names. So we had people who would come and say, I don't know, I feel something in my chest and it is not cardiology. So or I don't know, there's a lot of people in the early days, first wave, one of the most common symptoms that people came with, I feel a lump in my throat, right? Which was not a lump that was caused by a physical condition, but more out of, it was an anxiety reaction. As we know, anxiety has access to almost every cell of our body, and it can, there's an anxiety reaction, right? So people now realize, oh, some of the things that I do, feel, and think are not to do with my body or the conditions of my life, but to do with this one thing called the mind, which has been on the backbench of my own mind, right? So obviously people were more aware of the signs and symptoms, and obviously I think there was even a period in the hospital where people were, in my hospital, where people were joking that we were seeing as many as I'm a therapist, and I have seen as many as 45 people in a day, which by any given number of therapies is phenomenal number, right? Because each therapy takes about 45 minutes. So it was crazy. So while the rest of the departments, people were not coming, we had, almost every department was referring to us. And it was mind blowing. One. Two, people are afraid to come to the hospital, so every hospital has their own online services, which is a, as sir said, there is telemedicine available, there is telepsychiatry available, there is teletherapy available. And one more thing that we saw, I don't know if it is good or bad, but we had a mushrooming, as with any crisis, every crisis is also an opportunity for someone or the other, right? So we had a mushrooming of all these agencies that were providing mental health support. So we had HR personnel, we had coaches, we had corporate coaches, we had people who were spiritually oriented, we had elders with wisdom, all of whom are fantastic mentors and fantastic, were providing full on mental health services. Now, was that really helpful? Was that a good thing in mental health services? I don't know. I personally have reserved my opinion, because the person availing these services, see, you asked this question, right? As Ginny said very nicely, uh, people were coming, EAP services were on the rise, yes. Corporate companies come, as many as, 13 companies. We in Yashoda, I don't think there's any company that we are not doing. From, if there is a company in Yashoda, we are doing an EAP service for them. But having said that, it was very strange, because the people who needed the service were not really availing it, as it always happens. So the people who needed it, yes, WHO tells us that two populations: teenagers, that is adolescent population, geriatric population, most deeply affected by pandemic, two populations. Statistically, they have the distress level and the disorder level is on a rise. But these were not the two people who were coming. The people who were coming were the people who had access, who had resources. What about the people who did not have the resources, who did not have someone to take them? Lot of children were not being brought to the hospital simply because, was it safe to bring the children? Does it mean that children did not need the services? We can't equate that, right? So
Yes.
that's second. And then the third part of the question that you asked, I think we have had almost everybody coming to us. I can't say that we did not have a certain kind of people, from doctors to engineers to people working. See, because it was anxiety, either end. If people were overworking, they were coming. If they were underworking, they were coming. If they were over drinking, like sir said, a lot of people, actually drastically changed themselves. The lockdown period, if we just look at the national lockdown that we had, the lockdown was in so many ways, unconditioned people, deconditioned people, and formed new behavior patterns, which were beautiful. You could be your ideal self. There was a positive side to it. You could connect. We had people who were able to connect with their spouses. It's not all dark. We were able to be home, we were able to connect, we were able to form bonds, we were able to physically train ourselves, we were able to lose weight, we were able to just be something that non-pandemic was not allowing us. We were productive. So yes, that is to answer your question.
Yes, thank you. Thank you, Dr. Pragya. You have really answered it quite well. Yeah. My next question would be to Dr. Vasantha. Ma'am, we wanted to know, in this last 2 years, as there has been a lot of talk about mental health, there has also been talk about support from healthcare professionals, but also support from family. And are we now at a stage where we understand that yes, the family understands what is a mental health problem if one is suffering from it, and are they willing to come forward to support them? Yeah. Ma'am, before you answer, your mic is muted. Yeah. And you'll have to unmute, ma'am. Yeah.
Yeah. Am I audible now? Am I audible?
Yes, yes, ma'am. You're
Ah,
audible.
okay,
Yes.
right. No, I don't think the stigma is gone. Okay, I think people seek mental health services only when it is really mandated by the other consultant, or when they really have a dire need for it. I don't think the stigma is gone. Okay, this is, see, the problem is Generally, when a person is affected by even a physical illness, and if it happens to be a severe physical illness, it will have psychosocial ramifications. There's no escaping that. Okay, a person undergoes a transplant or a CABG, or a person has a severe illness, ulcerative colitis or something. They're bound to have some kind of psychological issue running along, either because of the disease or because of the loss of a job or loss of health or whatever, some way. The thing is, COVID highlighted that because COVID was so severe and so bad, and it affected every aspect of our functioning, right from social functioning. We could not go out. We were just marooned within our house. Then our employment was affected. So it affected every aspect of our living. So COVID sort of heightened the mental health aspects. But as whether people were willing to seek psychiatric help, no, I think they still dragged their feet. Okay, unless of course the person was highly suicidal, and it's not just a reaction to the COVID that was a problem. People had the entire gamut of psychiatric diseases. I've seen people who never had bipolar earlier manifesting with bipolar after COVID. I've seen people coming with delirium, people coming with cognitive problems, amnesia, people coming with just sleep disorders. It was not just reactive alone. We must understand there were a lot of immune reactions within the person and they had COVID. And right now in psychiatry itself, we are looking at certain immune modulators like interleukin 6 and all that, which are related to depression. And if you look in COVID, they were also measuring interleukin 6, okay, to see the amount of immune reaction they had. So the immune pathway was affected. So any viral infection, when the immune pathway is affected, like when they have, say for instance, HIV or we've seen people coming with psychiatric manifestations. Even otherwise, viral infections are notorious for this. Okay, but COVID magnified it. COVID was just too much. All right, compared to other viral infections. So, and the entire lifestyle also changed for the person, right? They were either within the house, a lot of stress at home, domestic violence, then loss of either a family member or either they were losing their income. So other factors also compounded the issue. So, but still, I think people were not so, they took psychiatric help only when it was absolutely needed. And the other thing I would also like to highlight was even our physicians must be made aware about the need for psychiatric help, even when the patient is admitted for COVID. Because many of our doctors also stopped the psychiatric medicines, and some of them went for a full-blown relapse there. They were worried. I do understand. They didn't know what the COVID was initially, so they worried about CNS depression, and some of our medications also can cause sleep and drowsiness. I do understand. But over a period of time, we learned the strategy, what medicine would work best, what medicine that does not cause much sleep or reduce your oxygen level and things like that. We worked on it. Okay, during the second wave, we were actually better prepared. And, the drugs that they were using also during COVID did cause psychiatric problems, like steroids. I'm not blaming the drug. Now, what am I trying to say is, when you have a major disease, you're bound to have psychosocial issues. I don't think you can wish away psychiatric problems. But people, because they had the stigma, they were not very willing to seek. It was a double whammy. As it is, they were feeling bad about COVID. And when you say, no, you have to seek a psychiatrist for certain issues, they were not too willing. But they did come. I did have a lot of these patients coming to me during the pandemic, post-COVID, any psychiatric disorder for that matter. And another thing we saw was that worried well syndrome, where people were actually healthy, no COVID, nothing whatsoever, went on checking for COVID. It's so much so the infectious disease specialist or the physician would refer the patient to me. How many times to do that? How many times to do the nasal swab? That is because the media was agog with COVID information. They would just flash so many thousands, so many 10,000s or 20,000s in COVID. They don't actually tell you the truth. Out of the crores, so many people got infection. So when they highlight this, people also get a lot apprehensive. But this we've seen even with the HIV and all that, where you have this worried well syndrome. The caregivers are also under stress. They were scared whether they will get the infection, and at the same time, they were also feeling guilty. And sometimes the person who brings the infection home recovers faster than the person
Yes.
who gets a secondary infection, who's second in the infection. Then again, they also feel guilty, so a lot of emotions and, trying to identify who brought the infection and things like that. That caused a lot of trauma also. And all family members were not in the same page with respect to COVID prevention. I've heard of families where the elderly people would just still continue to go out and say, no, 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 we don't believe in COVID. It's okay if I die. I'm anyway ready to die. Or you would have a youngster who would not follow the COVID norms. Okay. So everybody would not be on the same page. Then kids, how long will you keep a child inside? And if you're living in a flat, how will you keep a child inside a flat? So in any case, they had to bring them. So, people were also very confused as to how much should I do and where should I curtail and things like that. There's another point that would add to that addiction part. When we get data from the government as to how many people died of COVID and all that, you'll find one of the common comorbidities apart from diabetes and obesity. Another thing that is highlighted is alcoholism and smoking. And the people, when they smoke, their ACE inhibitors also, their ACE receptors increase, and COVID attaches to the cell through the ACE receptor. And the alcoholics, why they develop more problems is also because when you are alcoholic, your thromboembolic phenomena is increased. The tendency for that is increased. And COVID increases that again. So you have more physical COVID morbidity because of people who are taking alcohol and smoking. And a fellow who's smoking and alcoholic, they generally don't bother about their physical health. They are on a denial that nothing will happen to them. So these are the people who don't follow COVID norms also. So the vulnerability for COVID again increases. This also causes a lot of friction in the family. As it is, you're draining my resources and you're not bothered about bringing COVID here. So I think in a way, COVID affected every facet of our society. People who are already exposed to psychiatric help or some form of psychological help did come forward to seek help. But the stigma still remains. I think our public health service should improve. They must integrate psychiatric services along with general health care in the primary health center. Only if that is done,
Yes.
people will understand. Because if you look at any physical disease for that matter, say for instance, something as common as hypertension or diabetes. Now, it's not just a medication that brings out diabetes and hypertension. You must get the person to exercise, you must get the person to sleep well, you must get the person to attend the health checkup regularly. So, this is a behavior. So, no disease is devoid of your behavioral indices.
Yes, very
Same
true.
thing with COVID. COVID also involved a lot of behavioral control, right? Taking the vaccine, or wearing a mask, or avoiding a crowd. So I believe that we have to look at a person holistically. Mental health must go hand in hand with general health care.
Yes, very, very true, ma'am. Very, very true. And in fact, this is a very important point that you have brought out, that at the primary healthcare level, only if we can try and integrate all the mental health services together along with the physical health, it will make a lot of difference. Yes. My next question would be to Dr. Vishal. Dr. Vishal, what is it in terms of long COVID and mental health? Is there a connection, as ma'am has just explained, and have you all seen any incidences like that?
Yes. Interestingly, this pandemic has been very interesting because the virus act because of the virus kept mutating so quickly. So did the information regarding the virus. So no, there was the pandemic, then there's a viral pandemic, there was information pandemic also which was happening, and also there is mental health pandemic secondary to the excessive information which was available, and the information kept changing also very quickly. So I still remember by I think May 2020 they were already talking about long COVID. The COVID it has only become 2-3 months, but they're already talking about long COVID in May June. It was very fashionable and very important to talk about. Long COVID had happened. So now that we have almost we finished 2 years of actually COVID now. So long COVID is now. Now I've not seen any very credible papers or credible talk about long COVID. But it is true that some people continue to suffer from. So this I think this is what happened in my understanding of the situation. People who are vulnerable to anxiety, who says, I have no anxiety, I had no anxiety disorder or psychiatric disorder in the past. Some people after the COVID continue to have anxiety, worrying, depression, somatic preoccupation, worried whether I'll get COVID again, whether I've got COVID now again. Those kind of things I've seen in a lot of patients. And that all because that's also to do with the personality of an individual. Some people are very anxious or very anxious or conscious about their health, depending on how you look at it. So such people tend to worry a lot in terms of a circumstance like that. And like how ma'am was talking about, some people are very careless. So they continue to do bad behavior and also not bothered whether that bad behavior is going to put them in more trouble because they enjoy it. And mostly substance abuse is associated with it. And that's what she was referring to. So maybe their family members are more worried and they are not. So long COVID as of now, not much of a thing, but there are a few patients I've seen which have continued to have anxiety post. But also similarly, the people who say after injection, mujhe aisa ho gaya. So there are also a very small subset of people saying, doctor, I got an injection because of that. Then since then I'm not well. So they are. So whether we don't know whether it's personality which is playing a part there, but there's really some truth in that, because again we have to understand that biology always has exceptions. That's what they taught us in school. Our biology, everywhere there are people who you give sleeping tablets and they will be awake all night. So, doctor, I could not sleep because of this tablet, which is supposed to be a sleeping tablet. So, we have this variety of variety in biology. So in our brains, in our life. So I think that's why we see different example. That's a lot of people there. There's so much of opinion. There's so much of information, and that's a confusion which creates.
Yes, thank you. Thank you very much. Thank you. And we do definitely have a lot of people who never agreed, as ma'am has just explained, as Dr. Vasantha explained. There were a lot of people in one family, you had at least 10 opinions about COVID-19. So there were two people who were willing to follow and two people who were not willing to follow. And through that, there was a lot of confusion. It was only when someone in the family fell sick did anyone realize that yes, this is a reality and it is not something which can be brushed under the carpet. So thank you very much. As a token of our appreciation, we will give the speaker certificates. Speaker certificate for Dr. Vishal Chhabra.
Thank you.
Sorry, he's put Dr. Vasantha, Dr. Vishal Chhabra. Thank you sir for participating.
Thank you, ma'am. Thank you.
Thanks. We also have the speaker certificate for Dr. Vasantha Jayaram.
Thank you.
Yeah. Thank you, ma'am. Speaker certificate for Dr. Pragya Rashml.
Thank you so much, IndiGlobal Media Network. I really want to take this moment to thank you so much on behalf of Yashoda Hospital. This has been wonderful forum, and can't thank you enough for this initiative.
Yeah, thank you. And speaker certificate for Dr. Jini.
Thank you.
Thank you, Dr. Jini. Thank you all. Thank you very, very much for participating. Thank you. It's been a pleasure.
Thank you.
Thank you very much.
Bye.
Thank you. Bye.